All right, the next sort of category of dementia, I think hopefully all of you are understanding that maybe there's just a little more to dementia than just, oh, that person has dementia, right? There's a little more science to it. Is the Lewy Body Dementias. And so these are dementias that are typified by having movement disorders. And I would say what I would sort of hope that you can take away is well-formed visual hallucinations. And when I say well-formed, it's actually kind of characteristic for these people to have hallucinations of animals and small children. That's sort of the, like if I hear someone say, oh, my family member hallucinates children in my house, my like alarm bells for this diagnosis go off. They can have cognitive impairment, right? So memory, it can also sometimes be described as fluctuating, right? So people will say, oh, they have a good day and they have a bad day, right? And that's kind of common for this. Note that it's always there and it's always progressing, because I also mentioned that delirium can be fluctuating, right? But delirium is sort of reversible and fluctuating, and not with all of these other things. This is sort of more chronic and having kind of fluctuations with time. Pathologically, right, these are all typified by having Lewy bodies, which we'll talk about later because we're going to talk about Parkinson's, which are intranuclear, and I have a picture later, aggregates of alpha-Synuclein. So just unfortunately, words that probably don't mean a lot and are hard to connect meaning to, but important pathology. So I may have a little umbrella here. There's two different things. This is more important for step 2 and level 2. Dementia with Lewy bodies is when you have these motor symptoms of Parkinsonism and cognitive symptoms that happen within a year of each other, right? So someone comes to clinic and says, you know, my parent for 3 months has had this tremor, and for 5 months has been getting lost, hallucinating. That would be concerning for dementia with Lewy bodies. Parkinson's disease itself, which again we'll talk about, can have motor symptoms for a very long time and carries an increased risk of dementia. If the cognitive symptoms are a year later than when the motor symptoms started, the diagnosis is Parkinson's disease dementia. Both have Lewy bodies, both have the same pathology, it's just how we name them.